Good afternoon, everybody. This is Congressman Mike Levin. Thank you once again for joining us for another virtual town hall on the coronavirus. So we're grateful that you're joining us, whether you're on Facebook or Twitter or YouTube or on our website at mikelevin.org. We hope this is an informative 90 minutes where you learn a lot about the virus, about the public health response and the policy response. And as always, we are joined by Dr. Richard Garvin. Thank you, as always, Dr. Garvin, for joining us. He is truly an expert, really one of our local leaders and local voices dealing with coronavirus. He's an infectious disease epidemiologist, educator, and healthcare innovator who seeks to understand the causes of disease and translate that understanding into impactful solutions. He received his PhD at Johns Hopkins University and his MPH at San Diego State University, served as Epidemic Intelligence Service Officer and epidemiologist for 7 years at the Centers for Disease Control and Prevention in Atlanta before joining the UC San Diego School of Medicine faculty in 2005. Dr. Garvin's research focuses primarily on airborne and bloodborne infections, often associated with health disparities and substance use, including tuberculosis, HIV, and viral hepatitis in the US and abroad. His research on digital adherence technology over the last decade informs CDC and WHO guidelines on the use of telehealth for remotely monitoring patients with tuberculosis. Such technology has relevance today for COVID-19 monitoring and patient support. Dr. Garvin, great to see you as always.
Likewise, nice to be here.
Well, we've got a lot to cover this week. It's obviously been a very tragic week in many ways. We've seen really unprecedented numbers in terms of unemployment. Now over 33 million Americans filing for unemployment insurance in the last 2 months. We saw the unemployment number now at 14.7%, but far more than just an economic crisis. Of course, we know this has been just an unprecedented public health crisis. And sadly, we passed the 75,000 mark of those who've lost their lives from COVID-19 this week. And we're all shaken by that number. We're all prayerful for those families. This is so much more than just statistics. We're talking about mothers and fathers, sons and daughters, brothers and sisters, friends and colleagues. And I think it's important that during this time we do take sufficient opportunity to mourn for those lives lost and those families impacted. And we try to do that each and every week, thinking about those numbers is far more than just statistics. But in total, we have the most confirmed cases by far of coronavirus in the United States, with now over 1.3 million and 78,320 deaths. In California, we now have 64,597 cases and 2,630 deaths. San Diego County has confirmed 4,662 cases, and Orange County has confirmed 3,240 cases. There have been 169 deaths so far in San Diego County and 71 in Orange County. The California Department of Public Health continues to believe that the peak is still ahead of us, although is coming very soon. They've looked at mid-May now for quite some time. And I speak every day with leaders in San Diego, Orange County public health community, and a lot of the things that we have done, social distancing and the stay-at-home order, that have been very difficult. Nonetheless, the evidence suggests that those measures have worked. They have been effective means of preventing the spread of COVID-19 in our communities. I really want to thank everybody that I've been speaking with and meeting with lately, all of our mayors, all of our city managers, and a lot of our community and nonprofit leaders. And yesterday, Chrissy and I had the opportunity to go over to the North County Distribution Center for the San Diego Food Bank and donate some supplies, some food, some masks that were made by some of our volunteers. And I'm just truly grateful to them. And if you have the capacity, if you're able to donate to an organization like the San Diego Food Bank or any of the other wonderful organizations in our community, I certainly hope you'll consider that. And I also understand everyone's frustration. The stay-at-home orders continue. Certainly our businesses have been drastically impacted by all of this. But I would just implore us all to keep in mind that while we need to get back to work and back to our normal lives as quickly as we can, we also need to do so in a safe manner. And that's why it's so important that we follow the science, follow the data, and follow the guidance of our public health experts, which is why I'm truly honored to have Dr. Garvin each and every week to provide some public health perspective. We know that a lot of the barriers that we face have to do with testing. That continues to be a big problem in our country. Just this week, we're seeing now around 250,000 tests a day, which is a positive sign. That's a good step, but still nowhere near where we need to be. Harvard University has done the modeling that the state of California and the county of San Diego have relied upon, which suggests you need about 152 tests per 100,000 people per day to have an adequate number of tests. The same Harvard modelers are now suggesting that we need around 900,000 tests a day in the United States. So we still have a long way to go. In San Diego and Orange counties, they have goals of around 4,000 to 5,000 tests, about 4,000 in Orange County, 5,000 in San Diego County. Frankly, we still have a long way to go to get there. We're at around 2,500 tests a day in San Diego and around 1,500 to 2,000 tests a day in Orange County. I'm actually working on a letter to the public health experts in Orange County following a story from the Voice of Orange County this past week that documented how Orange County is really lagging behind some of the other counties like San Diego and Los Angeles. We need to do all we can to make sure that Orange County catches up with regard to testing. The sooner we hit the testing numbers that we need, the sooner we'll be able to reopen safely. We also are going to need contact tracing. People are going to need to be identified as much as possible. Those who are infected are going to need to isolate in order to keep our economy open as much as possible. And as I've said many times, we have two crises that we continue to address each and every day: the public health crisis and the economic crisis. The only way we deal effectively with the economic crisis in the long run is if we deal with the public health crisis and defeat the virus to whatever extent possible. And the other way to put it is you can't have a healthy economy without healthy people. As I mentioned in our past town halls, we've done a number of things in Congress. We've passed 4 bipartisan bills starting back at the beginning of March with the $8 billion supplemental appropriation, mostly for the development of a vaccine. That continues to be going well from everything that we've seen, and I'm very proud of a lot of our local companies and biotechnology community, life sciences community for their leadership on development of a vaccine. In mid-March, we passed a $200 billion bill, the Families First bill, that included emergency sick leave and enhanced nutrition assistance and additional support for Medicaid. Then at the end of March, we passed the CARES Act, now known as CARES 1, a $2 trillion plus bill, which included a lot of different things: $150 billion for state and local government, $100 billion for our hospitals, roughly $20 billion for the VA, another $31 billion for education, both K through 12 and higher education, $16 billion for the strategic stockpile, things like PPE and the rest, and then direct cash payments to people making $75,000 a year or less, $1,200, enhanced unemployment insurance, both for the gig economy workers, independent contractors, and then more overall, an additional $600 a week for those who are newly seeking unemployment insurance. And then finally, paycheck protection loans. That's been very controversial. Nonetheless, a lot of our small businesses were able to get those loans, not all that I would like, obviously. And then additional lending capacity for the Fed. And that's been pretty controversial as well, quite frankly. Then a couple weeks ago, I went back to Washington. We passed an interim bill, $484 billion bill that included another $320 billion in small business lending. Importantly, set aside $60 billion for community lenders and credit unions and the rest. That's been a very popular program for those lenders. And in addition to that, $75 billion in additional funds for hospitals, $25 billion for testing, and specifically the requirement that by May 24th, the administration would develop a national testing strategy for both standard diagnostic testing and antibody testing. We know that the missing link is the supply chain, and that the federal government has a unique opportunity to play a leadership role with regard to the supply chain of things like swabs and reagents. So we're going to hold them to that to ensure that that happens. Very important. So what is Next, we've been also making progress with Oversight. That's been a fair criticism of the CARES Act. We created the Select Committee on the Coronavirus Crisis, led by Jim Clyburn of South Carolina. And just this past week, that committee started its work by sending letters to certain recipients of Paycheck Protection loans, some of the larger businesses that we never intended to get those loans, basically demanding that those businesses return the money. So that was the first thing from that committee, and I anticipate much more to come in the weeks ahead to ensure that the nearly $3 trillion that we've spent on coronavirus relief, that there's no waste, fraud, or abuse, or at least as little as possible. I've also been working under the auspices of my subcommittee. I chair the Veteran Affairs Subcommittee on Economic Opportunity. And a couple weeks ago, we passed the Student Veteran Coronavirus Response Act, which follows another bill that we passed earlier on to ensure student veterans will not see a reduction in their monthly housing allowance or other benefits as a result of their schools moving to online instruction or closing due to COVID-19. And just yesterday, I introduced a bipartisan, bicameral bill to help military families terminate new leases affected by the Defense Department's Stop Movement Order. You may have heard that Defense Secretary Mark Esper ordered the first travel restrictions for military families back in March, later extended that Stop Movement Order for all service members and their families till the end of June. And what we know to be the case, unfortunately, is that tens of thousands of military moves that were planned have been put on hold. And in some cases, families who had already signed a new lease at their next location have been stuck paying for two homes at the same time. So my bill amends the Service Member Civil Relief Act to include stop movement orders. And I'm very, very proud that it was introduced, again, bicameral, bipartisan. So the leadership of both the Senate Veterans Affairs Committee and the House Veterans Affairs Committee, all on board with that legislation that we introduced. And the premise is simple. Service members should never suffer a significant personal financial loss as a result of following their orders. Simple as that. And it's just unacceptable that this is the circumstance for some of our military families. So we're going to do everything we can to help. In the weeks ahead, it should be everyone's priority in our government to help our heroes on the front lines, those most in need, regardless of what state or city they're in. It's not blue states versus red states. We need to help all of the United States of America. And that's why, as part of our next bill, which is being called CARES 2, the sequel to CARES 1, I am advocating for a lot more funding for our state and local governments, for our first responders, our law enforcement, our nurses, our teachers. And I'm really encouraged by the fact that we had this past week 9 mayors, Republicans, Democrats alike, join me in a letter to our leadership saying that we needed more money specifically for smaller municipalities that were left out of CARES 1. I was really proud and pleased to see that kind of bipartisan cooperation. I'm also going to fight for more funding for education, for K through 12 and for higher ed. I've now spoken with virtually all the superintendents in our district. I think they're doing an amazing job of adjusting to distance learning, but we need to do more to help our educators in our schools. That includes higher ed as well. I was encouraged that we got $44 million in the first CARES bill for UC San Diego, Miracosta, and Saddleback. I'd like to see far more. The estimates are that hundreds of millions of dollars have been lost, and that's just through the University of California system and the Cal State system. I want to see additional funding to secure our elections, to protect the vote. And I supported, those of you who've watched this, I've supported national vote by mail long before coronavirus. But I think what we saw recently in Wisconsin, where people were literally choosing between their safety and the ability to vote, that is unacceptable. We cannot allow that to happen again. And we need nationwide vote by mail. We also need to fight to protect the United States Postal Service, which is anticipating a significant revenue loss due to COVID, was originally expected to run out of liquidity next year, but has lost billions and billions of dollars as a result of COVID. And one of the many reasons to protect the Postal Service, we have over 100,000 veterans that work at the Postal Service. And I look at that through the lens of our subcommittee. We're going to do everything we can to fight for those jobs and for our veterans. So we're going to fight for hazard pay for our frontline workers, OSHA protections for safety in the workplace, more family and medical leave, increased nutrition assistance, full funding for COBRA, and a special enrollment window under the Affordable Care Act. And we're going to need additional unemployment insurance in all likelihood, and potentially another direct cash payment for those who are struggling. And we're going to need to put millions of Americans back to work, which is why I'd like to see a big, bold jobs program, including investments in infrastructure, broadband access, improving our water systems and our electric grid. Again, 33 million Americans filing for unemployment insurance in 7 weeks' time. We've got to put millions of Americans back to work. I'm also working with my friend, Republican Rodney Davis of Illinois, to include our Prevent Family Fire Act in CARES 2. That bill provides a tax credit for safe storage devices for firearms and is something that I think has a lot of bipartisan, I know has a lot of bipartisan support. We can dramatically reduce firearm-related accidents if we work together with our Republican colleagues, and with many children at home right now, including a tax credit for safe storage is the right thing to do. Finally, I've been saddened to hear stories of increased domestic violence during COVID-19, and I'd encourage anyone in need of help to call or text the National Domestic Violence Hotline at 1-800-799-SAFE. Again, that number, 1-800-799-SAFE. And along those lines, this past Wednesday, I led a letter with 37 of my colleagues to House Appropriations leaders calling for additional support for family justice centers that support survivors of domestic violence and other forms of abuse. So a lot going on. It's been a very busy week. And with that, I'd love to turn it over to Dr. Garvin for an opening statement, after which we'll be happy to get to your questions. Dr. Garvin.
Thanks, Mike. That was a lot of information to take in, but always good to hear the updates. Well, we're getting into a new phase of the pandemic, and it is going to involve a lot more activity by our health departments. The CDC is recommending widespread testing and thorough contact tracing to detect asymptomatic infections, interrupt the undetected transmission chains, and to further bend that curve downward. So I thought I would take a minute and just explain a little bit about contact tracing to the audience so that people are aware of what this is, because you're going to start hearing about it in the news. So the process of contact tracing is identifying people that have the infection. Now, they could be symptomatic or they could be non-symptomatic, but they test positive. Anybody that has the infection needs to be contacted and to find out who they've been in contact with. We call the people with the infection cases, and the people that they've been in contact with contacts. And the idea there is that if you can find somebody who is exposed to a case before they actually start shedding the virus and develop symptoms, and you can quarantine them in home away from other people, by the time they get sick, then they will not spread the virus to other people, and you can actually stop these chains of transmission. So if we ever want to sort of eliminate the virus from the population, this is the kind of activity that will help us get there. It worked with smallpox, it's worked with measles, it's worked with polio, it's worked with a number of diseases. It's a routine type of process that our health departments do and are very, very good at. This one's going to be a challenge, though, given the large number of people that need to be contacted and traced. We're talking about an estimate for California alone is going to require a minimum of 12,000 contact tracers working in health departments across the state in order to do this. It may end up being more, but the task is to try to find the people who are infected, find out who they've been in contact with during the 2-week incubation period, and get those people who are contacts into quarantine so that if they do get sick, they will not have spread the virus to other people. So a couple terms that people may hear that I think are important to understand. One is quarantine, and the other is isolation. Quarantine is what we do with people or animals or plants that may have been exposed to something that's infectious, and we put them into a place where they can safely wait to see if they were actually infected and developed the disease. And so in the case of people with coronavirus, we're talking about asking people to stay home and away from others for 2 weeks while they wait to see if the infection develops. You know, during that time, it's recommended that they're tested as well to find out as quickly as possible if they become a case. Because if they do become a case, then that starts the next chain of contact tracing. somebody will contact that individual and find out who they've been in contact with for the last 2 weeks, and then start to notify those contacts that they might have been in contact with a case of coronavirus. The other term is isolation, and isolation is what happens when somebody actually has the disease. They're supposed to stay separate from their family members and the public while they recover from the infection. Now, this can sound scary, but it's not really anything different than a lot of us have already been doing. You know, if somebody in your house has the flu or a bad cold, you tend to stay away from them. You give them some space in one room where they can recover. If they think they're infected, you know, quarantine means don't go out in public unless you absolutely have to for medical reasons. And if you do, wear a mask to prevent spreading the infection to other people. And so one of the tasks that the health department will do in contact tracing is they get a list of all the people who have either tested positive for the coronavirus or have developed symptoms and they're presumed to have coronavirus. The health department will contact each of those individuals and ask them who they've been in contact with over the past 14 days, and then get a list of those names. And then the next step would be to contact those contacts and notify them that they've been exposed so that they know now they need to be careful for the next 2 weeks until they find out if they're infected or not. And so this process takes a lot of time and a lot of effort. Health officials are highly trained in confidentiality to make sure that people's information is being kept private and confidential. The contact tracers don't have to tell the contact who the case was, so that could be confidential as well. And it's a really important effort, and I think the reason I bring this up is because I think it's very important for all of us to realize that we play a role in this. So if somebody should get a call from the health department or a text or some other message saying, please contact us, it's important that you do so. It's important for your health, it's important for the health of the community. And if you happen to be a case and you can provide information to the contact tracers about those people that you've been in contact, the more information you have to help them to get a hold of those contacts, the better job that they can do to inform those people about the need to quarantine and to provide them with the right information. In addition, while people are in quarantine or in isolation, there is a component of this which is linking them to the appropriate healthcare resources that they need to make sure that if they develop symptoms, a doctor is going to know about them and would be able to provide the appropriate information and get them into the hospital if the case should become severe. So my message is contact tracing is coming. It's important for all of us to be aware of it and to do our part to help out to make this process work and be aware. So and help to participate. I think it's an important issue, and I hope that everybody will do their part.
Well, thank you so much for that, Dr. Garvin. And I know we're going to be hearing a lot more about this. I saw the governor make that announcement this week, saying that we're going to need somewhere between 10 and 20,000 contact tracers in California. Isn't that right?
Yeah, the current number is at about 12,000 was the estimate for each state. There's an estimate for each state, and California got 12,000, but we're thinking it could be more. Just one other point I want to make about that is contact tracing doesn't really work when you're at the peak of the epidemic. There's too many cases. It's running its course. Where it really is beneficial is as things taper down, then contact tracing is very important to sort of mop things up and get those new cases that pop up into isolation and the contacts into quarantine. So this is going to be a really important component of reopening things. If we have good testing, good monitoring, and good contact tracing, then as there's little hot spots that pop up where we can get a hold of them, we can tamp it down again so we can keep that curve low.
Got it. Makes sense. Thank you for that, Doctor. We've got a ton of questions. We'll get through as many as we can. And if you have questions, you can go on Facebook or Twitter, and you can leave your questions or comments there. I know Ellen is doing an amazing job monitoring all of that on Facebook. You can also write us an email at townhallquestions@mikelevin.org, and we will get to those as quickly as we can. We've got a bunch that have already been submitted, and we'll start with Judy in Oceanside, who asks, will we be getting any more stimulus checks? Because of my age and health issues, I won't be able to go to work until there is a vaccine, which will be a year plus. Will there be checks in the future? Well, we don't know completely, Judy. I think that there are a number of proposals in the House right now that would provide additional cash payments. Some of them would be on a recurring basis. Some of them would be on a one-time basis. And I think those discussions are being had. I certainly would support additional cash payments of some form. I think we've got to be cognizant of how long this pandemic is going to last and keep people from making an income. I think we also have to acknowledge the fact that a huge percentage of people who were just let go from their jobs, who just went on the unemployment rolls, did not get one of the $1,200 cash payments in the first go around. So that's something that we need to be cognizant of as well. So I would imagine the House will come out with its proposal on CARES 2 that will include additional cash assistance. That'll be a matter of getting Mitch McConnell and Senate Republicans to the table to negotiate that and a variety of other provisions in CARES 2. But we look forward to doing that very soon. Here's a question for Dr. Garvin from Roberto in San Diego. As we think of reopening schools, what conditions do we need to do so safely? That is a great question, because I wonder about that myself, and with two young kids at home who miss their friends.
Yeah, well, as an educator myself and the husband of an elementary school teacher, both been working out of our house for the last 2 months, I asked that question too. So before we can come back together, we all need to practice what the CDC calls everyday preventable actions. These include hand washing, avoiding close contact with others, covering your mouth when around others and when you cough or sneeze, and disinfect surfaces regularly. This is, standard. We should be doing that anyway for all reasons. When the schools do reopen, appropriate social distancing will be recommended, masks should be worn, and all campuses will need to be cleaned and maintained on a regular basis. A couple other points that I think are important are that we don't send our children to school if they're sick. That's just good practice anyway. I know sometimes, we think about just, pushing through it and, getting our jobs done, our education done. But in this case, it's really important that they don't go to school if they're sick. And with this disease, it may be important to keep the kids home from school if there's somebody else in the household who's sick, because we know that at the younger age, oftentimes the infection is asymptomatic. Also, at home, it might be important to maintain some social distance between the children and those in the household that might be at risk for severe disease, such as those that are elderly, obese, have diabetes, and other health conditions that put them at higher risk for severe disease. And the CDC recommends that all schools that open maintain contact with their local public health departments for recommendations based on the unique environment and the number of cases that have been reported in their community. So when things are working well, social distancing is working, there may be so little disease in the community that we can be a little bit more relaxed. But then if there are cases that pop up, it's important to be in touch with the health department so that schools know, okay, there's been some cases, we need to maybe be a little extra diligent and careful. So that schools will be communicating with the health department regularly for advice. And then further, the CDC recommends that emergency preparedness be assessed and protocols for isolating students who are identified with COVID symptoms are in place so that they can be addressed quickly. So I think we're going to be able to get back to school. It's going to look different, but we know how to beat a virus. We could do this. We just have to work together.
Well, I want to thank your better half and all the teachers out there. I know it was Teacher Appreciation Week this past week, and they're doing an amazing job in speaking to the superintendents around our communities adapting to distance learning and distributing the technology, and the support obviously of a lot of parents as well, helping to figure out how those software programs and all the rest, how it all works. It's been really a remarkable effort by our school districts and by our teachers, and we're always grateful for our teachers, but I think we recognize their importance probably more now than we ever have. And we're just very grateful. Please pass that along, all right?
I certainly will.
All right, excellent. And it's Mother's Day tomorrow, so it's a double whammy, right?
Absolutely.
Excellent. Next question is from Esther in Oceanside. She asked, the president is mandating meat production to continue to operate despite dangers to the workers, adding that workers will be barred from bringing lawsuits against the corporations should they be infected at the workplace. What can be done to protect these workers and their families? Well, first and foremost, nobody should ever be forced to work in unsafe conditions, period. And I think we've got to get PPE into those facilities. We've got to make sure that workers are safe. I think we're trying to do all we can in our next CARES Act and even in the interim to hold the administration accountable, for a failure to deliver PPE. I saw in one instance where the vice president made a point to promise to one particular facility that they would receive PPE, and they didn't for weeks after that. We now know from looking at a variety of these facilities that many of them are unfortunately very fertile grounds for this virus, and that we're seeing transmission in some of these facilities, along with places like prisons, and of course in some of our nursing homes that should be a cause for concern for everybody. But I think at the end of the day, if one of our workers is feeling sick and they've been in close contact with others, they need to be able to go home and recover. And we have to ensure the safety of our workforce first and foremost. So that's why it's so important we get this next bill done, because I think we're going to fight for strong OSHA protections and for additional sick leave and medical leave for our frontline workers. So thank you. I share the concern that you raised, Esther. Here's a question for Dr. Garvin from Nancy in Vista. She asks, if you are totally isolating, is there a time period after which you start to lose your natural community immunity? That rhymes. Like when toddlers start to attend preschool and catch every cold. I can relate. I remember those days very well. Any thoughts on that? Yeah,
it's a really good question. I don't think there's a lot to be worried about. We're not going to be isolated that long, hopefully. But just to kind of give a little bit of substance to that question, when babies are born, they're all born with some antibodies from the mother's blood. They share blood in the womb, and when the babies are born, they have antibodies that are from the mother that protect the baby until they can develop their own antibodies. And this usually lasts for about 6 to 12 months, and then that starts to wane. And then the children start to interact with their peers and their siblings, and that's when they start to become infected with colds and flus and chickenpox and everything else like that. And when that happens, the immune response includes priming cells that are called B cells. These B cells are what produce antibodies, the long-term antibodies that protect us in the long run. And once those B cells are primed, they sort of sit in your immune system waiting until viral antigen floats along and it says, uh-oh, I'm being attacked, and it starts spitting out these antibodies in order to protect us. And so that's the natural immune response that occurs. For most diseases, it's lifelong for things like chickenpox and measles and a number of other diseases. We do know that sometimes that immunity does wane, and an example of that was an early pertussis vaccine, where the vaccine started to wear off as kids got into about college age, and there were some outbreaks, and when that was realized, the CDC recommended booster doses, and now those kids are immune for longer as well. So we do know that there is some waning of immunity. The likelihood that being quarantined or locked up in your house for even a year or so will affect that level of immunity that we have against all the other diseases that are common in our environment is very, very unlikely. If it was something that you would lose immunity to that quickly, for example, like a common cold, then you might get a common cold again, but it's not going to be any serious diseases that we need to worry about.
Interesting. Thank you for that. Linda in Oceanside asks, what is Congress doing about renter protection? Linda, that is an excellent question. To date, we have not done enough. In the CARES Act, we focused on federally backed mortgages and we provided forbearance. I know there's another effort to look at all mortgages in the United States and try to extend the term of the loan commensurate with the length of the pandemic to help our lenders out. But rental delinquency is going to be an increasingly significant problem. And what we have decided with the next CARES Act, one of the priorities is to create a fund for emergency rental assistance. And I know that's being debated. I think we're going to need to get bipartisan support for that and for all the other provisions of CARES too. But I think it's something we're going to fight for. And the current figure that I've seen is a $100 billion fund for emergency rental assistance. And I think that's something we're going to need to do. We're also going to need to be aware of the commercial mortgages and commercial rents. The Paycheck Protection Program that we passed for the small businesses is 8 weeks, basically, of rental payments. But we know a lot of commercial mortgages are going to come due and a lot of commercial rents are going to go unpaid. So these are things that we're well aware of and things that we've got to address, ultimately assisting at the federal level as necessary. And I'm absolutely committed to doing that. Thank you for the question. Rick on Facebook asked for Dr. Garvin. I'm seeing conflicting reports of scientists confirming that recovery confers immunity or maybe not. What's the best data on that right now?
Well, that's the $100 million question that a lot of people are asking. And so just to kind of give you an update here, based on our knowledge from other viral infections, the expectation is that having antibodies against the SARS-CoV-2 should protect against reinfection. However, because of the new virus in humans, we don't really know the answer to that yet. There's a couple of factors that play in here. One is how long does that protection last? There may be antibodies that are present in high enough levels that will protect against reinfection for maybe months or years, but we don't know if that'll be lifetime immunity yet. The other thing is we don't know yet how generalizable the antibodies are to genetic variances in the virus. So you may have a very strong immune response to that exact same virus if you were to be reinfected, but if the virus sort of shifts and mutates as it passes through other people and it comes around again and it's a different virus, we don't know how strong the immune response will be to that new strain. Now, we've talked before about genetic shifts in the virus, and we're not seeing a lot of that kind of shifting or mutation in this particular coronavirus to make people too concerned about whether or not vaccines will work. But again, this is something that needs to be explored a little bit more to understand. And also there's a big problem with false positive test results on the antibody test. Again, this is new. We're still developing the technologies to do the testing. And just because somebody tests positive on an antibody test, we don't know if that means that they truly have been infected and now they have antibodies. And then the question is whether or not they're immune. It's possible somebody may have a false positive test on an antibody test, become infected, and then that would look like the immunity is not strong, and it might actually just be due to a false positive test. So the problem here is, even though we think that there may, we're hopeful and we think that there's a good chance that the immunity will be protective, the problem with making any hard claims about the protection from antibodies is that the consequences of getting it wrong could be severe. And what I mean by that is, if we start telling healthcare workers that they have antibodies, so therefore they're protected and they can go back to work and not have to worry about PPE and things like that, and they all of a sudden, and we're wrong, and they all of a sudden start getting infected, it's going to decimate the healthcare workers that are protecting us. Same thing is true for nursing home workers who may, think that they're protected and might not have to be as careful when they're working in the nursing homes, and they may actually get infected and infect people in those nursing homes. So that's the concern, and although there's a lot of optimism that immunity will be protective, the CDC is being extremely careful, and the WHO are being extremely careful, And so to this date, they're not endorsing that antibodies protect people from infection. Antibodies are considered fairly reliable in saying that somebody has been infected, but to go that next point and say that they're protecting, that they mean that you are protected and don't have to take additional measures, we're not at that point yet. So scientists are conducting studies to better understand the level of antibodies needed for that protection and the duration of that protection, as well as factors associated with whether a person develops a protective antibody response. Those studies are going on. We don't quite have the answer yet, but hopefully we will soon.
We certainly hope so. That would be really helpful. Kathy, here's a question from Kathy, who's a retired nurse in Rancho Santa Fe. She says, in Rancho Santa Fe Village, I saw 10 people standing around outside of a coffee shop this morning. No social distancing, no masks. How can we flatten our curve significantly if people continually show lack of foresight? Well, Kathy, that's very frustrating. I share your concern. I think it's really important that we follow the public health advice and the guidance, whether it be from the federal government, the CDC, or the state, or the county, or the cities. And we know that we've all got to do our part. And this is a very serious virus and something that we all have to be aware of each and every day. And that's why we do these town halls each week with an infectious disease expert to hopefully encourage you to follow those rules. But what do you say, Dr. Garfina, the people out there that disregard all of this? I don't know if we have the best answer boiled down in 30 seconds or less, but maybe we should.
I think that, as I've said before, we know how to beat the virus. We know how it's spread. We know how to protect ourselves. If we're not wearing masks and we come in contact with people and they're not infected and we don't get infected, we say, well, I guess we don't really need masks. It's not that important. But all it takes is, one person who enters into that group of 10 who has the infection, and everybody's going to be exposed, and then we're going to regret that. So I think, you could play Russian roulette and take your chances, or you can do what we know will actually work.
Let's just keep leading by example. That's all we can do. Here's another question for you from Donna in Vista. Donna asks, our neighbor has been welcome to use our pool in the hot months for years. Since she does have to be in public and we have health concerns, can she use the pool? If we said, please wash before coming, just jump in the pool, don't touch anything, then leave, can she still use it? We're staying home and not having company. We'd just love to say yes, but won't if it's not advisable. Interesting question.
Yeah. Well, Donna, that's really nice of you to share your pool with your neighbor. I grew up with a pool. I know how important that is in these hot months that are coming up, and it's a nice thing to be able to share. So let me just do a little information there, and I'll let you make your own decision. But I think a lot of people are going to be thinking about the same thing. So according to the CDC, there's no evidence that the virus that causes coronavirus, COVID-19, can spread to other people through the water in pools, hot tubs, spas, or water play areas. Proper operation and maintenance of these pools, including disinfection with chlorine and bromine, is absolutely essential. If that's done correctly, the virus can't survive in the water. You're not going to get it from swimming in the water that somebody's been swimming in. That's the good news. Now, the other part is that what else that person does when they're in and around the pool could put people at risk of transmission. So a lot of the public pools are closed now because people don't just go into the pool and leave. They use the locker rooms, they use the bathrooms, they use drinking fountains. So if that's the case, then we need to be thinking about how to make sure that either those facilities are closed during this time or they're properly maintained and disinfected. So in order for people not to be infected from these other things. That goes for lounge chairs around your pool, that goes for pool toys and things like that, so you may want to think about that with your neighbor. The other thing is that if people are coming to a pool, they tend to be within that 6-foot zone and might not be wearing masks, and so just the social distancing is important in that situation. Because the virus can be spread from coughing, sneezing, or even just talking and breathing. So being careful there. One consideration for Donna in this case is that, although the risk is very low of your neighbor coming and using the pool and leaving, and, if they're not hanging out with you while they're there, is that if you have people in your household who are at high risk for severe disease, you may want to make sure that those people are not coming in contact with the pool, within a short period of time after your neighbor's left.
Interesting. Well, when Congress finally gets back and everybody's back crowded in the Capitol again, I'll be asking you about what to do when I'm stuck in elevators with people and all the rest. I think that's been the biggest frustration is we haven't been able to figure out the right protocol. The House Attending Physician is a Navy admiral, and he basically would not give the green light to the House to come back. And it's as much for all of the support staff and all the other folks that make our nation's capital the town square of democracy. So maybe we need you to tour it and to figure out how we can all stay healthy.
Love a tour of the Capitol.
There you go.
My advice there might have been, well, instead of taking the elevator, take the stairs, because then you'll get the double benefit of a little exercise. But if you've got, 100 or 400 Congress people walking up and down those stairs, huffing and puffing in close proximity to each other, I think that sort of defeats the
Well, and the
benefit.
challenge, in all seriousness, the challenge is that the way the Capitol is designed, and we're going a little off topic here, but quickly, you've got the House office buildings that all connect via underground tunnels. And then you go through the tunnels to the basement of the Capitol. And then you have very narrow staircases for members or very small elevators for members. And it also happens that you've got 435 of the most sociable people probably anywhere. And we like each other, and we like to, know what's going on and speak about issues in our families and all the rest. And that's how a lot of business gets done, candidly, in Congress. And then you go to another packed little room, the cloakroom, where you have a myriad of other conversations with your colleagues. So this is not good from the perspective of managing social distancing. And I think we really are going to have to think it through before we get back to voting and everything else. Or we're going to have to do it like this. And as a 230-year-old institution, it's been tricky, to embrace new technology like this, although I know a lot of my colleagues are ready. I'm certainly ready, willing, and able to go back. And I'm not so much worried about me, but I am worried about some of my colleagues who are, older or have pre-existing health issues, and also all the support staff. So we'll figure it out. We'll figure it out. I'm confident of that. Julian in Dana Point, he has questions for both of us. First for me, he asked me, what is your reaction to the sight of tightly crowded beaches 2 weekends ago, which seemed to have led to the governor issuing the order, and then the protest rallies by hundreds of people, many unmasked but wearing political paraphernalia, being held at the very time the judge was hearing arguments on the case? And then the second part of it is for you, doctor, which he asked, as an expert in communicable diseases, what effect do you think these crowded rallies may have on efforts to control the spread of the virus? What I will say, Julian, is that I am a big believer in free speech. I think that we have to be very aware of free speech rights in these cases. That being said, I think that we can't have a situation where public health is being put at risk or jeopardized. So that's the balance that we have to weigh. And I would like to think that people can peacefully protest and express their opinion without violating health orders or putting others' health at risk. I worry when I see hundreds of people in close proximity without any masks for the very reasons that Dr. Garvin just mentioned. We should be worried about that for the very reasons that these rules are necessary. So I think that's the balancing act. And, law enforcement, by and large, in my conversations with them, have been reasonable in understanding that balance. But I think that's the crux of the matter. And I think this is going to, unfortunately lead, yes, it will lead to more people getting sick if people aren't following the public health advice. So my recommendation to anybody who's thinking of protesting is go ahead, but be safe about it. Wear a mask, keep your social distance, and try to follow those public health guidelines. Anything, Dr. Garfin, on this?
Yeah, I think that's a great answer, Mike. I would agree that, this is a time when people are hurting. They're hurting financially, they're hurting emotionally. People want to get back out into public and do things that we're used to doing. And, in terms of protesting, I fully agree that, we should have the right, we should be able to do it, but we need to do it safely. I would also advocate, though, for, taking some of that energy that's being put into protesting and just basically fighting against these efforts to control the virus and say, okay, if we want to get back to work, how do we do it safely? So put some of that mental energy into figuring out creative solutions for, all right, if I don't want to spread my virus, how am I going to go to the market or go to work or go to church without infecting anybody else or becoming infected? Let's put that energy into that. And so just in terms of what do I think about, the possibility of spreading of disease in these situations, I think it's a very real possibility. The virus comes out of our throats and our noses when we cough and sneeze, but also when we shout and cheer and yell. And, we found there's been studies that show that singing is a very, very effective way of aerosolizing virus and spreading it far distances and exposing other people. So protest rallies are a dangerous situation if people aren't wearing a mask. And there's a lot of people that don't have symptoms, maybe because they haven't developed symptoms yet or they won't, but still are infectious and can infect others. So, everybody has the right to speak their mind, and I think we all should never lose that. But if you're going to go out there and do it safely, wear a mask. The protest here isn't we want to get rid of masks. The protest is here we want to go back to our life as normal, so we have to do that safely, and protesting by not wearing a mask is not a good idea.
So I have a related question that I've been seeing a lot in the news about, which is, and you may or may not have a comment on this, or maybe we can cover it next week, but I know that a lot of sports and other things, they're trying to figure out how they get back on track, how they reopen. And one of the suggestions, in fact, I even saw this with regard to our political conventions. We've got our Democratic and Republican conventions coming up over the summer, is you could have a big stadium that might hold normally 80,000 people, but you only have 15 or 20,000 people in attendance, and you keep your 6 feet between people. Would that do the trick, or are we still putting people, it seems like we're still putting people at a pretty high risk as they get to their seats, as they move within the corridors, which always, there's usually a lot of people crowded in, although maybe they can figure out a way to really limit the amount of people coming in at any one time. But I found that very interesting and something that I thought I would bounce off of you.
Yeah, I think that's going to be a challenge. I think you hit it on the head when you say, yes, people can sit in seats that are far apart, but just getting people filtered into the stadiums and out safely, coming through the parking lots, people are going to have a tendency to congregate. There's so many opportunities there for transmission to take place, not to mention the guys on the field who are actually, throwing a ball back and forth to each other. And, we've all watched the pitcher, lick his hand before he, throws the ball. I think that we could try to cut down the risk in different ways. I think the other thing is that as we have more testing available and we can sort of monitor the situation in various communities and say, all right, there's very little coronavirus here, maybe some gatherings would be safe because there's very few people that are potentially infectious. But if a community has a higher prevalence of infection, then gathering people together is not going to be a good idea. So things will improve in that area, I think, as we get more testing available, and then also have a response in place like the contact tracing and isolation that will help us to manage the infections that we do find to stop those chains of transmission.
Got it. Very interesting. Susan on Facebook asked, what about the stimulus money for Native Americans? I understand they had not received anything. Well, Susan, you are correct that at least up until a few days ago, we had put $8 billion in the CARES Act for the Native American community. And up until very recently, they hadn't received any of it. And we were all very frustrated, troubled by this. And it's my understanding that this past week, they received about 3.4 of the 8 billion, of course, leaving a huge amount still to be distributed. So we are absolutely trying to fight for the rest of that money to be distributed in Native American community without delay, because those funds are desperately needed in Indian country, and that's why we included them in the CARES Act. So hopefully we'll have some good news on that front very soon. Here's a question for you, Doctor, from George in Cardiff. George asks, we're told to stay 6 feet apart when outside of the home to avoid the coronavirus. However, I've had the experience of smelling secondhand smoke from a person 20 or even 30 feet away when out and about. If smoke particles can travel from inside a person's lungs that far away in the form of secondhand smoke, can the coronavirus also travel that far? Is 6 feet actually sufficient? Thank you for all these informational briefings.
You're welcome, George, and that's a great question. The reason that you can smell those smoke farther away than 6 feet is because smoke particles are small enough that they're actually lighter than air or can be suspended in air for hours at a time, and they're referred to as aerosols. So, and they can travel further than 6 feet. And there's evidence that that coughing and sneezing, as well as breathing and talking, can create aerosol-sized droplets containing the coronavirus. However, most infections appear to be among people that are in close contact. So while aerosolized virus can be infectious, the concentration of the virus and the environmental conditions such as how hot it is outside, how much humidity, whether or not there's sunlight, whether or not there's wind, all of these factors can diminish the probability that any virus floating in an aerosol will actually be breathed in by somebody in the vicinity. To really understand the risks of infection, one needs to think about the conditions needed to transfer enough virus from one person to another to cause infection. So, for example, an infected person generating high concentrations of the virus containing droplets through a cough or a sneeze could infect another person in close proximity within just being together for a couple of minutes. If they're further apart, the two people would have to be together in the same place longer so that there's more chance for some of those smaller particles to actually flow through the air and get to that other person. If an infected person who's not coughing or sneezing, they can still generate aerosols and small droplets through breathing and talking, but these concentrations are lower. So the amount of contact time that two people would have to be together in close proximity would be longer to spread it. So think about sort of the amount of infectious material that's going to be put into the air. And if the sick person is really sort of coughing and sneezing and spreading a lot in the air, you don't have to be, you don't have to be next to them for too long before you're going to breathe some of that virus in. If they're just sort of talking and breathing, then it would take longer for the right situation to happen where you might breathe in some of that virus. And if you increase the physical distance, you decrease the possibility of all that.
Interesting. I have another one for you. We'll try to get through some of these as fast as we can. This is from Lori in San Clemente. She says, like many others, I watched Dr. Fauci in the White House as he announced the preliminary results of the remdesivir study. We know that another antiviral drug, Tamiflu, for seasonal flu can be very effective at lessening symptoms and duration of disease if taken within 48 hours of onset of symptoms. If you wait later than that, the doctor will not even prescribe it. In the case of the remdesivir trial, the drug was administered to patients who were already hospitalized. If the drug were given earlier in the course of the illness, is it possible that it would have a greater beneficial effect? Why didn't anyone ask this? Thanks.
Great question, and that is very exciting news from Dr. Fauci about the effectiveness of remdesivir. In that study that was done, it was used in over 1,000 patients who had severe disease. They were in the hospital, and they showed that the patients that got remdesivir were released from hospital sooner and they survived better than those that didn't get the remdesivir. So it's currently shown to be effective for people with severe disease. That's what that study didn't do, is it did not look to see whether or not, like Tamiflu, if you give it to somebody early on, does it reduce your likelihood of developing severe disease? Now, that might very well be true, but we don't know that yet. And so that I don't know with certainty whether or not that study is being done, but I would imagine it is, and we're still waiting for the results on that. There is the ability to use drugs off-label, and it's possible that somebody could say, hey, I'm going to, if it worked for severe disease, I'm going to try it for less severe disease. But there's some problems with that. The studies that are being done, these clinical trials, are designed not only to see if it works, but also they're looking for safety, because drugs have unintended side effects, and we need to understand that. And the more people you give it to with different underlying health conditions, the more we're likely to see some of these side effects. The other thing is looking at the actual efficacy. Does it work the way we think it is? If it's not, and it turns out that remdesivir doesn't do anything to prevent the development of severe disease, and only helps people that actually have severe disease, then we'd be using a lot of that drug that might be really helpful for protecting people that are hospitalized for people that don't really need it. So that wastes cost, it wastes drug, and what it also might be doing is it might be distracting the efforts to find a drug like Tamiflu for coronavirus, because if we think that we've got the drug, we might not be putting in the effort to find one that actually does work. So the studies are important. I know it's frustrating for people, but unless we wait for the results and recommend treatment based on the evidence, we could be making some really big mistakes, and the mistakes can be more harmful than the delays.
Thank you for that. And obviously, we're all keeping very close tabs on remdesivir, and obviously, we want those doses that Gilead donated to actually go where they're supposed to go. That's another matter altogether. Next, we've got a few similar questions. John in Solana Beach, Mike in Encinitas, Ellen in Oceanside all asked some variation. The Trump administration has stated that it will not allow members of the COVID-19 task force to appear before House committees. Reasons given are too much time for the busy task force members and not enough tests for the House members. These same task force members are permitted to appear before the Senate. On May 5th, when asked why the unequal treatment, the president stated that the reason was because the House is a setup. Quote, the House is a setup, and quote, the House is a bunch of Trump haters. Does the House have any legal or constitutional means to challenge this decision based on the true reason? Well, look, it is unacceptable that the House of Representatives and the Senate are put to two entirely different standards when it comes to oversight, when it comes to being able to hear from our public health leaders. That is our constitutional responsibility, and we're going to continue to demand to hear from these leaders. I think to a person in the House of Representatives, we have incredible respect for Dr. Fauci, his long history of service to our country, and his ability to clearly and consistently just tell the truth to the American people about what's happening. In fact, it was a briefing with Dr. Fauci that first really signaled to me, this is back in sometime in early February, mid-February, just how significant this was going to be. And I immediately went back to my office and told my team, you better get some sanitizing wipes and wipe down our desks and all the rest. Because, I mean, Dr. Fauci has been clear and consistent through this whole thing. So what I also know is that a number of my House Republican colleagues want Dr. Fauci to testify in the House. We just need to continue to move forward and apply whatever pressure we can in the House of Representatives to ensure that we maintain our appropriate oversight role. And I would hope that reason will prevail because this cannot be politicized to this degree. We are trying to get the best information so that we can figure out how we legislate, how we move forward with the expenditure of literally trillions of taxpayer dollars. We've got to hear from the experts, and that's all we're asking. Here's a question for you, Dr. Garvin, from Ninette in Oceanside. She says, I hear that International travelers are coming into LAX without any screenings or quarantine instructions. I think they should be quarantined and then tested. Care to comment on procedures at LAX or our airports?
Yeah, this is a tough area, and I think it's based more on politics and feasibility than it is on good science and good practice. It's not an area of expertise of mine, so I had to do a little bit of homework on that question. As of April 7th, the State Department says that U.S. citizens and legal residents are permitted to return from the UK, Ireland, and the European Schengen area, which is basically all the 26 European countries. If they visited those countries in the past 2 weeks, they're allowed to return to the United States, but their airlines will be rebooked to flights coming into one of 13 designated airports in the United States where they're able to do some evaluation of people coming back into the country. And then any citizens returning to the U.S. from China will be required to be quarantined for 14 days before returning to the United States. I'm not sure exactly how they're enforcing that or how they're implementing that, but that's what the State Department's website says. In terms of quarantining people and testing people, there's a little bit of a challenge there, which is right now we don't have enough tests for the whole country to be doing the amount of testing that we need to be doing. To be doing testing for everybody entering into the country through an airport would divert some of those tests, and I don't think that's a reason not to do it, but it's one consideration. The other consideration is that right now there isn't really a rapid test that you can do where somebody comes off of a plane, you test them with a swab or something, and you know the answer in a few minutes, and then they can move on. Even here in San Diego, a lot of the testing that we're doing for the virus takes, 2 days in a laboratory to get the results back. So, how would you manage those patients coming through an airport? It's challenging. I think we need to put pressure on the administration to figure that out. More work needs to be done on it. I'm not sure how well it's being done, but it's an important issue.
Another one for you from Eric in Rancho Santa Margarita. If someone has a mild case of COVID-19, does that mean that they could be contagious for a longer or shorter amount of time?
Yeah, good question. I've read a few studies on that because it's an interesting question. If you get a whopping case of coronavirus, you build up a good immunity and you get over it quickly and you don't shed the virus as long. Excuse me. It looks like from the studies the results are mixed. There appears to be a wide range, which may depend on the severity of illness. In one study of 21 patients with mild illness, 90% tested negative for the virus 10 days after the onset of symptoms, and the tests were positive for longer in patients with more severe illness. In contrast, another study looked at 56 patients with moderate to illness, and half of those patients tested positive more than 24 days later, with the longest person testing positive for the virus 42 days later. However, what those tests were looking for was the RNA or the genetic material in those viruses, and it doesn't look like the virus is actually infectious in those people. And so according to the CDC, when the viral RNA was detected in patients 3 days after recovering from coronavirus, no virus was detected that was capable of causing infection. And in addition, there hasn't been any documented evidence that infectious virus can be found in the throats of people who were tested more than 9 days after the onset of illness. So it looks like the amount of evidence that there was virus can be found for longer periods of time for people that had less severe illness. But in terms of the infectiousness of those individuals, it doesn't look like there's really any difference.
Interesting. One more for you. And we've had similar questions in the last few weeks from time to time. Abigail in Del Mar asks, can the virus penetrate envelopes in the mail system? I use gloves to open the envelopes, but do I have to worry that the virus could be on the documents inside of the envelope? And should we all be using gloves when we check the mail?
Well, that's an excellent question. So good news is the virus doesn't penetrate paper. So and it can't replicate outside of the body. So if it gets on a piece of paper, it's not going to grow like some bacteria or fungus that you might see growing on an orange. You have what's there, and it's constantly dying as it sits there. So the longer it sits there, the less viable virus there is. And the best study that was done shows that the virus can survive up to about a day on cardboard, and I would assume paper being the same. So if somebody happened to have coronavirus, you put a document into an envelope and mailed it to you, by the time it actually arrived at your house, the inside is probably not going to have any infectious virus in it. Now, the question about should you use gloves or something when you open your mail, it is possible that the person who's delivering the mail may have been infectious and might have touched the outside of the envelope, and there could be virus on the outside of the envelope. So, it wouldn't be a bad idea to treat that as something that is potentially infectious. And so if you feel the need to wear gloves to open your mail, that's one thing. But washing your hands after you've touched the envelope is perfectly acceptable. The virus won't go through your skin. It has to get into your nose or mouth or eyes. And so if you bring the mail in, you open it up, you carefully put the contents aside, and you put the envelopes in the recycling and go wash your hands, you should be fine.
Got it. Okay, that's good, because that's what I do. I'd be worried there for a minute. Another mail question from Sarah and Dana Point, but very different. She asked, what can be done to rescue the U.S. Postal Service? She also says 55 cents to mail an envelope seems to me to be quite a bargain, especially compared to sending through a private company, UPS, FedEx, etc. Personally, I would totally support a significant rate hike. Is that on the table, or other solutions? And she says, thanks so much for all you do for us in the 49th. Well, Sarah, what I would say is that we have to save the U.S. Postal Service. It is responsible for delivering 48% of the mail in the world. It employs over 650,000 people, as I mentioned before, over 100,000 of whom are veterans, and life-saving medications and so much else that we absolutely have to make sure that we protect the integrity of the Postal Service. And I think what has been proposed is both grants and loans. There's legislation from my friend Joe Neguse from Colorado, and Jerry Connolly, who leads the subcommittee of jurisdiction, has been a very great advocate for the U.S. Postal Service. And I'm just really grateful for our letter carriers and our postal workers that are on the front lines of this as well, who are doing a terrific job. And so we're going to fight like you know what in the next CARES Act, in the CARES 2 bill, to save the U.S. Postal Service. And I think that's one of the things we're absolutely going to draw the line on. And we have to, because I think it's critically important. Here's a question for you, Doctor, from Steve in San Clemente. Steve asked, this is the first time in my life where I don't feel like I can rely on the CDC for accurate information. The CDC is supposed to be tracking and organizing the response to the pandemic, and obviously that is not happening. Is it because the coronavirus is just too big of an event for the CDC to handle? Is it because they've been underfunded for too long, or are they just being sidelined by the Trump administration? What do we need to do to restore the CDC to what it once was? Tough question. Oh, Doctor, I don't think we can hear you.
Sorry about that.
There you go. Now we can hear you.
Thank you. Yeah, Steve, as somebody who worked at the CDC for 8 years, I hold that institution near and dear to my heart, and I hear what you're saying. I think as taxpayers and citizens, it's crucial that we have confidence in our governmental agencies, including the CDC. I feel the same way about the FDA, the USDA, the EPA. These agencies are there to help to protect us, and that's why we pay for them. So I think if we are not respecting them and underfunding them, then their ability to do that job is only as good as our confidence and our resources that we put into them. So just to give you a couple insights about the CDC, because I think that's an important question and I want people to be aware of how the CDC operates. They rely heavily on data. CDC scientists are loath to convey any kind of inaccurate information, and they make recommendations only on what they have evidence to back them up with. So unfortunately, that's also why the CDC is often criticized for being slow with their recommendations. If the data don't exist, then the scientists at the CDC don't want to say do something because they frankly don't like to be told that they've got it wrong. And so sometimes they'll err on the side of caution, and that can be frustrating for people. Since the president appoints the director of the CDC, as well as the NIH and the Health and Human Services Agency, unfortunately, sometimes politics do play in. But in my experience, the scientists in the trenches prefer to let the data speak for them rather than politics. So, it can get political, but I think that the scientists are really trying to do the best they can based on the science. CDC employs or funds scientists to conduct a range of basic science research and epidemiologic studies that help everyone, not just in the U.S., but around the world, so that we can better understand how pathogens behave in human and in animal populations. They also create preparedness plans and conduct tabletop exercises so that when an outbreak does occur, they have roadmaps already in place to know how to respond. This would have been a perfect example of one. In addition, the CDC conducts surveillance in collaboration with the WHO and other countries so that when something like this happens, we find out about it early and hopefully we can contain it before it gets out of control. Some people criticize the CDC as well as other research institutes for wasting time and money on studying unimportant diseases. Case in point is coronavirus. Coronavirus was typically thought of as the common cold. So who spends a lot of money studying the common cold? Well, fortunately, there were scientists that felt like it was important to do that. I guess, even though it's not deadly, it's still an inconvenience, and maybe it's worth understanding it better. It turns out that the first SARS, then the MERS, and now the SARS-CoV-2 viruses are all coronaviruses. So the fact that there were actually people tinkering around with these supposedly unimportant infections actually really helped us. So I think in terms of looking at what these agencies work on, we can't always be too harsh to judge people that are willing to work on things that aren't the latest and greatest and most exciting things because they may end up providing useful information. I also think that it's really important that we realize that when public health isn't a priority and only the essential functions are funded, we don't have the preparedness and the surge capacity to be able to respond to things like this. And I think that's really what's happened lately, is that the importance of public health has sort of fallen by the wayside a bit. The agencies have had budget cuts in recent years, and so when you have budget cuts, you do the most important things that you have to, but you don't have that extra capacity to absorb any things that come up that were unexpected. And I think one of the big problems with public health, and being in public health for over 20 years, or sorry, I should say 30 years, we realize that it's sort of a, it's one of those careers where when you do a good job, people don't know it, and that's the problem. When you prevent diseases from happening, nobody knows that you did, and so you don't get the credit for it. But for that reason, politicians tend to cut budgets for diseases that there aren't a lot of. And so it's sort of a curse of our own success. The better job we do at preventing diseases, the less money we have to continue doing that work that we needed to do to prevent those diseases. And I think that's important for people to realize. And we're seeing the folly of that thinking right now. The investment that it would have taken to quickly control coronavirus, if we had spent that money all along, pales in comparison to how much we're spending now to try to deal with the situation. So what should we do? We need to increase funding for our federal, state, and local health departments. We also need to fund education in science, medicine, and public health to train experts who will work in these agencies. And we need to compensate the workers appropriately in order to attract the best and brightest minds to solve the problems that impact us all. And then I'll just sort of wrap that up with talking about what kinds of scientists I'm talking about. Public health requires a broad range of experts, from doctors, nurses, and veterinarians to biologists, chemists, physicists, and engineers, behavioral scientists and psychologists and communications experts, all the way to administrators, policymakers, lawyers, and ethicists. All these people work together collaboratively across institutions, and they play a vital role in ensuring the health of our nation. I think that in order to be effective, these agencies, CDC, NIH, World Health Organization, they need the resources in place to do the jobs that they do well so that we can all go about our lives and not have to worry about the diseases that are affecting us, and knowing that if something does happen, some rare situation like coronavirus, there will be a response that will take place quickly and effectively, and we don't have to scramble when it happens.
Wow. So thank you for that incredibly thoughtful answer, and just know you have my steadfast support, and we've been fighting budget cuts since I've been in Congress across the board. Every year the president's budget has had draconian, dramatic cuts to our public health agencies, and we fought that, and also NIH and NSF and all the rest, and we fought it every single year, and we'll continue to advocate for it. I think if history is any judge from everything that I have seen, we'll figure it out as government for a while. We'll fund things for a while, but then as time elapses and as the last pandemic becomes more distant, we won't be as proactive about funding things. But the warning signs were all there. All you have to do is go back and look at any of the Bill Gates speeches from 2015, 2016, 2017, who's a new constituent living at least part of the time in Del Mar. So we thank Bill and Melinda Gates for their advocacy. I had a chance to be on a phone call with him recently, and it's clear that it's a matter of when, not if, we will have another virus that could turn into an epidemic or a pandemic, and the more preparedness we have, the better off. So I absolutely support that. And in terms of the CDC, I haven't seen any specific misinformation from Bob Redfield since I've been in Congress in our briefings with him. There obviously were problems with the first test, the reagent problem that we've talked about with regard to the COVID-19 test. But the quality of information that we've gotten from them has been reasonable. And, they came out with 17 pages of guidance the other day for all sorts of different businesses, for schools and for beauty salons and for all the rest. And the administration would not release any of that guidance to the American people because they said it was overly prescriptive. Well, that's unfortunate. So I'm glad that, however we got it, we did get to see it. The press figured it out and sent it out to be seen by the American people, because it was very valid and valuable information that the CDC is trying to provide for the American people. So I will continue to support CDC with everything that I can, because they have to be that honest broker of information to help get through the worst crises that we face, public health crises that we face. Here's another one from Mike in Encinitas. I noticed the flag in the holder on the bookshelf behind you, right there. Can you share info? In any case, the service and sacrifice it represents is honored and appreciated. Well, thank you, Mike. That is the flag that was flown over the U.S. Capitol in honor of my grandpa, Ted Levin, who fought in World War II. And that you probably can't see. It's actually my other grandparents, my mom's parents there, and my dad, my father's father, my grandpa, is up there with all his pictures from his service. So thank you very much for asking that question. Here's a question for Dr. Garvin from Adele in Solana Beach. Does the medical community have a consensus on the effectiveness of individuals wearing gloves while out conducting essential business, apart from those providing services?
I'm not sure about the medical community in a consensus, but let me tell you the advice I have on wearing gloves. When we're talking about an airborne infectious disease like coronavirus, the virus has to actually come in contact with mucous membranes in order to cause infection. So it's not going to get through your skin. It's not going to even, as far as we know, get through like a torn cuticle and get into your blood and cause infection there. It needs to get into the eyes, nose, and throat, find the appropriate cells in those areas, cause infection, create more virus. So the purpose of wearing gloves might be that if you know that you're handling something that actually has coronavirus on it and you don't want to spread that to another, to another object, wearing gloves may be useful, particularly if you're cleaning up after a patient that has it, or somebody, or you're using a lot of disinfectants in an area. They'll protect your skin while you're doing that cleaning. But whether you wear gloves or not, the point is that if those gloves or your fingers become contaminated with the virus from touching, infectious material, you need to not put those fingers or those gloves into your hands, eyes, or mouth. And so the need to wear gloves is probably not so great with an infection like this, and it really will sort of depend on your circumstance. But for the most part, if you're shopping, if you're driving in your car, if you're touching handrails or doorknobs, the point is that you just be aware that you now may have contaminated your skin, and you don't want to touch your face with those fingers until you had a chance to either use hand sanitizer or wash them.
Got it. Makes sense. Neil in San Clemente asks, showing support and appreciation to the frontline workers is critical at this time. What is being done to take care of the workers who put themselves in harm's way and became ill by the virus? Was there a provision in the relief bills that were passed to provide assistance to them? We have 2 family members who are nurses, and they both have the virus. Well, first of all, I'm very sorry to hear about your family members. I thank them for being on the front lines, and I thank all our frontline workers. We had last week a frontline appreciation event virtually, and we're just so grateful for everybody that is putting their own health and safety at risk to protect the health and safety of others. We have in the next round of the CARES Act, CARES 2, the HEROES bill. And what this would do is basically a few things. It would provide hazard pay. It would provide a recruitment mechanism, a recruitment incentive to attract and secure frontline workers. It would include things like OSHA standards. It would fully fund COBRA. It would provide a mandatory window for the Affordable Care Act. So there's a variety of things that we want to do for our frontline workers, and I couldn't agree more that we need to keep them front of mind as we move forward through all of this. And that's what we're going to do. We're going to, we fought earlier for expanded paid sick leave and family leave, and we're going to do a lot more for our frontline workers. So with that, Dr. Garvin, we're almost out of time, but I would love to turn it over to you if you have any concluding thoughts for this week.
Well, I just say, stick with it. We're still in the middle of it. Don't give up. Keep social distancing, keep wearing your masks. It's working. It actually, we were, the statistical models show that we should have had about 12,000 deaths in San Diego so far, and we've only had about 187, I believe. So we have managed to keep control of this epidemic. We just have to keep it up because there's a lot more people that haven't been infected than have, and if we scale back too quickly, we're going to get that surge of new cases. So we just have to stick with it.
That's an amazing statistic, and I want to thank you as always, Dr. Garvin, for just being a phenomenal resource for our community and for helping to share just the facts and the data, and we're very grateful. I also want to thank all the moms out there. I want to wish everybody a very happy Mother's Day, including my mom and my wife and my mother-in-law and everybody out there, and I want to say thanks to our incredible staff. Ellen, also happy Mother's Day to Ellen for monitoring all the comments on Facebook, and to our great campaign team, Adam and Hunter, and all of our staff, to Jeremy, doing a great job with videography as always. We thank them. And I can't stress enough, just as Dr. Garvin just said, we've come a long way in the last 7-8 weeks to dramatically decrease the incidence of infection and of death throughout our communities, and we need to just keep it up. And it's frustrating, I know, but we haven't come this far to allow things to be reversed and to allow the rate of infection and the rate of death to needlessly go back up. We've got to now finish the job and get back to a place where we can safely reopen our economy. And I think that's what we're all interested in doing. So just keep up following that advice of the public health experts from the CDC on down to our state and our cities and our counties. And with that, stay safe, stay healthy, have a very happy Mother's Day tomorrow, and I'll look forward to seeing you again next week.